Welcome to Doctors In. I'm gonna be your hostess for today, Lulia Houbi, and we have with us Dr. Taher Al Khalil. Dr. Taher Al Khalil, you are a multi-gifted man. You are a chairman, you are an owner, you are a director, supervisor, publisher. Which role do you like the most?
The best role I like is the healer, the doctor. It's the most rewarding profession because you see a problem, you try to solve it, and when it's solved, the reward is the happiness of the patient.
Sure.
And this is an art by itself. You cannot have a job of a doctor. It has to be an inspiration to really wish to heal people.
Dr. Taher, you have around 15 publications in different topics. For example, for women fertility and boneless in women and on IVF, to name a few. Could you please tell us more about this experience?
Well, from the very start of my career, I was very interested in women's health. Starting from young age to achieving puberty, to the problems after puberty, to the problems with menopause, up to the end. And this is why you find my line of research is all moving between cycle disturbances, fertility issues, how to address fertility, and menopause, and how to have a good quality of life. Because now with the advent of medical treatments, we can achieve quite a long lifespan, and we need to stay healthy in this. Women at the age of menopause, around 55 or so, if they are not well managed, they quite age prematurely. And now age is to the 90s and 100s, so we have to stay good and healthy and good quality. So most of my research was addressed to how to improve the quality of life of women's health.
Dr. Taher, what are the common manifestations of hormonal disorders and treatment and complications?
This is a very important question because hormonal disorders are more common than what we think. And there is a lot of myth about it. In women, very commonly you have irregular cycles. And people don't know that an irregular cycle is because of some hormonal disorder. Sometimes simple things, sometimes very big things. Premenstrual tension, for example. 30% of women have premenstrual tension. They think it's a normal thing.
They ignore it.
Sometimes it's not, and it's because of some issues that's very treatable. And the whole house, the whole family is relieved from a problem that we think is normal or that the lady is just nervous. Now, problems like excessive hairiness on the skin or acne, appearance of acne, especially after the age of 20, or hair loss or excessive oiliness of skin, or unexplained weight gain that despite of everything the weight is growing pain. All these point to the presence of a hormonal disorder in women. Then let's come to issues of fertility. Issues of fertility, sometimes they are because of a gynecology issue, but many times it's because of some hormone is not working well. A thyroid hormone, a pituitary hormone, some other that is affecting the fertility potential of women. Not only the fertility, even miscarriages sometimes is because of the hormone problems. Sugar showing during pregnancy. Women who develop heart disease in middle age, 90% of them have a hormonal disorder and they're not aware of it. Then comes the menopause and the problems of menopause. I always say feminine forever. Before, we used to live to the 60s and 70s. If menopause happens at the age of 50, then 60, 70, she's an aging woman, goodbye. But now we live to the 90s. If you take away the first 20 years of your life, which we were growing up, the adult life from 20 to 50 is only 30 years. From 50 to 80 is another 30 years. So you cannot live half of your adult life an aging woman. Then comes the issues of safety. We hear about cancer and hormones, etc. All this has been cleared. If you do proper practice, if you do proper monitoring, it's like driving a car. You follow traffic rules, you are safe.
Exactly.
You don't follow traffic rules, yes, you are not safe. This is the same with any of the hormonal management. Now, let's come to children. In children, first issue you think of is growing taller. Many children are short. They go to their pediatrician. He tells them, you are okay. When you reach puberty, you are going to grow taller. But many times it doesn't happen. And then the time is lost. So it's better to check, find that there is nothing, better than not check and discover that the boy now became with a hoarse voice and a mustache and his bones are fused and we cannot let him grow again. It's too late. So this is one. Newborn. Now most countries, as soon as the baby is born, they check from the umbilical cord of the baby that he does not have thyroid disease. Every day a newborn is born with a thyroid laziness means he's going to have a mental retardation. But if you save him from day one, he will grow normal. And this is why now most countries do this monitoring of TSH from the umbilical cord of the newborn to cut on the incidence of mental retardation. Then come men, the forgotten race. Men, of course, have many disorders. They're not like women. I always say women are like Rolls Royces and men are like tuk-tuk. Why? If we take the hormonal pattern of a woman over 1 month, she has some hormones that go down in the first days of the cycle and go up in the middle and then go down again. Others are low and then in the second half they go up for 14 days and go down. Some slowly rise, slowly down, slowly. So you have a big pattern of many hormones up and down. While in men, all the hormones are one level. Simple. While for women, it's a complicated thing. So we tend to focus very much on women disorders because there is a lot of changes that can happen in this pattern. In men, it's not that bad, but they still do have problems. They have thyroid issues, they have potency issues, sexual disorders, they have also fertility issues, they have diabetes, and of course for both men and women, and it's rising very quickly. The instance of weight gain in the whole world is becoming a phenomenon now, and due to many things. And of course comes the anti-aging issue. We all now need to live well. Medically, we became better. There are treatments for heart disease, there are treatments for diabetes, there are treatments for hypertension, even cancer now, we are conquering many cancers. So we are going to live longer. So anti-aging didn't become a vanity now, whether for man or woman. We need to stay healthy, young, and in a good mood, good morale, and good looking also.
Absolutely.
And this is now the newer developments in hormonal disorders and so on, is how to treat the person holistic, to look at him not only today and after 50 years, to stay young. And it's not, as I say, a luxury now, because we will live longer, we need to stay healthier. And when we talk about anti-aging, which is an issue, many doctors, many centers offer anti-aging creams, lotions. This is no anti-aging. 80% of it is hormonal management. 20% of it is preventative medicine. You cannot treat a person with heart disease and diabetes and obesity and say, I'll do anti-aging for him. You have to treat the diabetes, treat the heart disease, treat the obesity, and when he's healthy, then you can apply anti-aging.
So like treat the main problems inside, then the effects will show on the look.
Because anti-aging at the end is preventative medicine. It's just to make you healthy. healthy, look good, physically fit, emotionally fit, sexually fit, all, okay? But it can't happen except in a healthy person. So anti-aging, first of all, be healthy.
From inside.
Not take a cream or these pills or these injections. This is no, unfortunately, there is a lot of commercialization in this issue. But if you work scientifically, this is it. Of course, there are other issues like newer trends now, stem cells and anti-aging factors that are, and this is going to revolutionize the medicine, but most probably this is a topic of another question. This is a question that covers my whole specialty, manifestations, treatments, and complications. Yeah. Let's start with the manifestations. You'll be astonished that so many manifestations or symptoms people suffer from cannot think it is because of hormones. Starting from headaches, to weight gain, to even sometimes muscle cramps, bone pains, mood changes, sleep disorder, anxiety without reason, are all parts of a hormonal syndrome that, and the art here is to collect these to know the puzzle, to clear the puzzle. So, for example, in men, say, can develop something called adult growth hormone deficiency, middle age, which we used to call it middle age syndrome before. When he starts to have a belly, he's a bit depressed, he's sexually not happy, and things are going down. We discover that these symptoms, for example, are because his growth hormone is now a little bit low, so his tear and wear is not there. He starts to wrinkle and age quickly. Treat, he's fine. Let's take another example about a hormonal problem in a woman. Okay? A woman who has a cycle that is regular, but before every period, she has a little spotting before the cycle. And she doesn't know, is it this my cycle or is not that mine? This also points that there is a defective function in the ovary that needs correction. So with very few symptoms are enough to let us make what is the story. Children, if they're not growing well, sometimes the first symptom of thyroid disease for a child is his school achievement is down. He was bright and then all of a sudden he's slow now. What happened? Okay, this is good. Memory changes in men or women, sometimes because of hormonal. So there are so many symptoms. It's the job of the doctor to analyze this plus this plus this. It shows there is thyroid problem. Let's check the thyroid. This plus this. No, there is adrenal problem, and so on and so on. Complications are many. Let's take, for example, the polycystic ovaries. It's the most common hormonal problem in women that we have, in which the ovary, I don't like the word polycystic really, is the ovary makes many eggs, many eggs. The many eggs excrete many male hormones and female hormones. The male hormones will not turn the woman a man. In fact, male hormone in women is responsible for them being feminine. Okay. So in fact, they are more feminine, but they pay taxes. What is the tax they pay? They start to have oily hair, hair loss, little pimples, a little hair coming here and there. The cycle starts to be irregular. Her weight, she needs to do a lot of work to keep it steady. Stable, yeah. Her mood, sometimes a little premenstrual tension. These are all the symptoms. Now, what complications can happen? If we don't treat, if we don't control, she's liable not to have a baby, or have a miscarriage, or have sugar diabetes during pregnancy, or even, as I said before, 90% of heart disease in women, they have polycystic ovary. So these are the complications we are looking at. Breast problems. We tend, all the medical profession and even the public, consider that breast pain in women is normal. And most of the times it's normal, before the period, 2 or 3 days. But if the pain is so excessive and is more than only a few days before the cycle, I have seen one time a lady, her husband is taking her on a wheelchair, she's complaining from pain.
Okay.
Yeah. We never think of pain in the breast as an important symptom, but sometimes it shows that there is
It's a big
a problem somewhere, maybe in the pituitary, maybe in the thyroid, maybe in the ovaries itself. But we tend to dismiss it as a normal to have a breast pain. In fact, even in books, there is no much talk about how to investigate a woman who have breast pain. We call it mastodynia in medicine. So there are so many manifestations. You are not aware it's hormonal disorders. There are so many complications, as I said. Come to treatment. You tell a patient we'll give you hormone treatment and he's scared. Hormones. Hormones in the public means cancer or sex. They don't mix these two, correct? But it's not. We correct the imbalance. We don't make an imbalance. The imbalance is going to make a problem.
Absolutely.
But if we correct the imbalance, what is high, we bring it down. What is down, we bring it up. Then the patient becomes healthier. People think when they take hormones, they'll become fat. Yes, if they take hormones for allergy, for bronchial asthma, for joint pain, high doses of cortisone, yes, they will, because they are taking pharmacologic doses, high doses. But when we treat to control, to adjust, who is fat will become thin, who is aging will become younger, whose skin has a problem will go away, with the hair loss. So at the end, you will look and feel better and be healthier when you take the proper hormonal treatment by correcting the imbalance, not by giving hormone.
Dr. Taher, you have established and directed SOLTARC, Sharjah University for Laser Training and Research Center. What's the relation exactly between the laser and the hormonal disorders?
I'm very proud that I was one of the founders of Sharjah University Laser Training Center, and we have trained up till now around 550 doctors.
Wow.
And they came to us from many different parts of the world, as far as Canada, as far as Nigeria, Indonesia, Malaysia, and many participants, of course, from the UAE and Gulf. The question, what brought me into laser, I am always asked this question. And if we trace it, it was in 1996, and I am very much into the work of polycystic ovary, as I told you. And one of the most common manifestation is development of hairs over the face in young women. And I started to read about new technology, the laser at that time, to remove hairs permanently or reduce hair permanently. So I thought of complementing laser with my hormone treatment for better results. And I was pioneering here in this area. And I did burn my fingers a lot with a lot of equipment that were not correct, a lot of technology, etc. Finally, we achieved a very high status of laser treatments. And I wished, because we didn't learn laser in schools, or in medical schools, so I wished to establish a center, academic center, which properly teaches laser away from the commercial side of the salesman who keep telling every doctor, this is the best machine, this is the best equipment. And this is how we did. And the second reason why I did it is because the laser has mushroomed, whether in effectiveness, it became very effective, or in its applications. It goes now into everything in medicine. So this is how I got linked into the laser by treating excessive hairiness in women. I added it to my endocrine treatments. Then I found it is effective. Its applications are so many. So I kind of co-specialized in the laser. And I think I am now one of the top people in the management and the training of laser specialists. We are proud that the Department of Health request our courses for approval of licensing.
Okay.
And we are hoping that we are more and more regional in this reason.
Sure. Doctor, what are the applications of laser in medicine?
When we started laser in '96, there was, in the medical field, there was only eye laser for eyes and very few surgical lasers, and maybe a little bit for ear, nose, and throat, but there was nothing else. Then it started by hair removal. Then it moved that we can remove wrinkles, that we can remove pigments effectively, safely. Before, equipment were not effective, not safe. They became more safe now. We can treat post-acne scars. We can even treat active acne. We can treat now many skin conditions like scars, like stretch marks, like skin laxity with lasers, non-invasive, no complications, with very good treatments. Then it moved to other applications. It started to move, for example, to gynecology, to women disorders. We found that laser can do tightening if there is laxity of the vagina, even there is the womb, if it's prolapsed, it can improve it. If the urine incontinence, it can improve it, especially after deliveries. And it can also treat a lot of postmenopausal problems like dryness and so on by laser. So the laser became a tool that can help in many specialties. It only needs training. And this is why I established the center in Sharjah.
It's like a miracle. It's like for everything.
Technology is always growing,
Dr. Taher, could you please enlighten us about the future trends in medical field?
That's also a very interesting question for me in particular. Why? I'm proud I did pioneer in hormonal disorders starting from 1973 onwards. And then I went into lasers since 1970 onwards, 1978 onward. But now there is a new facet in medicine that's going to change medicine completely, which is stem cells. We hear a lot about it. There is a lot of myth about it. There is a lot also of quacks about it. But I recently visited a very large center for stem cell research in China that belongs to link to the Chinese military medical services. And it's a huge place. And I was amazed from the things they are now doing. Like, for example, take stem cells from the fat of one person, then change it, program it to make cartilage, inject it over 3 weeks. It will go and make new cartilage in the knees, in the hip, and the patient will not need a joint replacement. Or they do it to try to improve Alzheimer's disease. Or they do it to try to control diabetes, to be more controlled diabetes. Infertility issues also. In so many areas that now I think that the future is going to go into 2 areas. Stem cell, where we will treat many things by stem cell, no more pharmacological or surgical treatment. And the other area that is going to be the trend is anti-aging, not for the vanity, as I said before, but because we are simply going to grow older much, much longer. Our age span will be long, and we need to stay healthy. And this is the whole meaning of anti-aging. There are, of course, many things that are of no scientific value. But if we just focus on the scientific achievements in these fields and benefit from it, I think we will be much healthier and happier.
As a conclusion, Doctor, what's your message for the audience?
Well, the only message I can give is I can give to my patients and my friends who are my patients that whenever we can do the best, we should do the best, whether in finding out what is the problem or solving it. If I want to give you a message to my younger colleagues who just started their profession, starting on, always read well, always follow technology, see what is the latest. Don't be scared of venturing newer treatments, provided you know what you're doing and you have learned enough about it to pioneer. Because as we pioneer more and more, we can help more and more people. At the end, as I told you, A doctor is a healer. He's not in a job. He's not working 6 hours or 8 hours a day. He's 24 hours a doctor. And if you have this feeling, you will be the best doctor. Thank you very much.
Thank you very much, Dr. Taher Khalil, for this useful information. And I want to thank you for watching us today. I was with you, Lulia Hobby, from Doctors N. Thank you.